it changes the relationship with the people you serve a little bit. What do you think? Do you see any benefit for this? No?
Hey, Andrea, it's Brenda. Do you want people to unmute, or would you rather them put it in the chat box?
Sure, unmute. So some people have opened up more over the phone. Yep, that happens sometimes, is that sometimes it's easier for people. We used to, when we would drive people in the car and people would look out the windshield and weren't looking at us, sometimes they'd open up more. And I bet sometimes people are opening up more on the phone. That's great. So now we know something about that, right? Anybody else seeing anything? You feel free to unmute, feel free to put it in chat, whatever you're most comfortable with. The person who's on the phone, I'm sorry to call you that, but I don't have your name. Did you want to say something? So it's slowed down. Yes, that's a big thing. So it's not probably so crisis oriented, right? Because everything slowed down. So that helps. Helps us get different kinds of things done and really talk to people about issues.
Can you hear me?
Yes.
Yes.
In Central, we're seeing an increase in homelessness.
Oh,
Mm.
that's not good. Why do you think that is?
I'm not sure. Maybe loss of jobs, loss of income.
Yeah.
I'm not sure.
Yeah. We had hoped to stem some of that with the eviction prevention and, you know, making sure that people had money, but sometimes it's just really hard. Do you think any of it might be that people are coming out for more help? Or do you think that people are really newly homeless?
I think that might be the contributing factor, the need for help.
Well, I think that that's a positive, right? If people who have been homeless are really connecting to help in a different way, that might be a positive. If it's really upping the numbers, that's not so great.
Right.
And I'm interested to hear why that is. Anybody else seeing any differences? No? Okay. So, silver lining for me is that persons who have been living on shelter in the community for long periods of time have a chance to be in hotels. That's huge, right? And access to a roof over their head, bed and showers, and they're getting matched to programs that help them assist them in housing. That's wonderful. And that, you know, in the hotels, people are where you can find them for one thing, but they also experience a little bit about some of the elements about what being housed are, so it might increase people's motivations. That's great. And you think that some of the places that people used to go are closed. Yep. And it's easier to get people into hotels than it is to ask people about going to shelters. That's huge.
Yeah.
That's huge. You can also get a chance to see what the behaviors are like in hotels and start to work on them before they get into housing. So that's often a big thing. People have other comments? These are great. Thanks, you guys. So what we're going to do today is we're going to go over sort of what are the expectations in an outreach plan, how to keep safe during COVID. So we're going to talk a little bit about that, both for the people you serve and for yourselves. And we're going to talk a little bit about how to make adjustments to your plan that reflects the current environment, reflects the COVID crisis, but also affects where you are with staffing and everything. And then the next steps to updating and submitting your plan to Demas, to Brenda. And Brenda, did you want to say something? No? Okay. Shannon, you want to,
Yeah.
Brenda?
Yeah, I just want to reiterate, Brenda, if you want to interject at any time, please feel free. So the goals of the outreach plan, it's a really very comprehensive plan that's meant to support coordinated and collaborative outreach efforts. So what the goal is to house people as efficiently as possible using all the resources available as rapidly as possible and safely as possible given COVID, that whole umbrella over our current situation. To identify people quickly, hopefully these new people becoming homeless, we can find ways to incorporate in the plan how to identify those people quickly, reduce any risks associated with homelessness. And maybe the current environment has helped us to identify partners or work with them in a different or a closer way. So we could do that and minimize duplication of services. And again, use all available resources. We're having to find new and different resources that haven't been common in homeless outreach efforts. So how do we do that? And how do we use the plan to help us focus on those things? So these are two linked resources here. There's the outreach plan template, which you all should have, and you all had completed and gotten to Brenda in March. So how are we looking at that? That's a theme for this whole webinar. How are we looking at that strategically in general and also specifically to do with COVID? And then Lauren put together a sample outreach plan. This is an idea of how you might complete it, and there are some examples of there and how you might update it given the current COVID situation. Outreach plan sections. We're going to really hammer home how you might look at the plan in light of COVID. So we might hit these points a couple of times. So these are in general that outreach plan sections, and I just want to call out a few of them that might differ given COVID. So canvassing schedule, in-reach versus outreach, how is that? That's going to look very different. Some people aren't going out as much. Some people are doing much more phone contacts versus in-person contacts. When you do in-reach, how has that changed? Some places have closed. Libraries have been closed for a while. I'm not sure if they're still closed in your location or if people are staying indoors more. The in-reach might be more to a hotel right now than to the local fast food restaurant or the local hangout where people were staying prior to COVID. Engagement plan, how have the most vulnerable people changed? There might be similarities, there might be some changes in who you are able to identify as most vulnerable at this time. Case management, this is something we're going to talk about later, how you target your clients for case management, and are you targeting all of them for full case management? Do you have the resources to do that, or are you targeting a smaller list of the more vulnerable clients for full case management this time? Yes?
And I think Brenda wanted to say something. Can we unmute her?
When I could find her.
Sorry. Earl B.
I'm looking. There we are. Okay.
Oh, there it is. Can you hear me?
Yeah, I can hear you. Yeah.
Okay. I don't want to jump in and interrupt you, Shannon, but when you have a break, I'll just say hi to everybody.
Okay, great.
All right, thanks. So just to finish up this slide, emergency plans, that's something we're going to talk about later, but COVID-19, as you all know, is an emergency. So what specific things are we putting in place to address health concerns, health risks, to keep the people that we're serving as safe as possible during this time. Engagement supplies, how the supplies changed, and what do we have, and what do we have a plan to obtain in the future.
The other thing that you want to consider in the emergency plans is how you're going to keep your focus on housing and how you're going to help people get housed when they are in different places.
Yep. All right. Next slide. The next few slides, this slide and the next few slides are going to focus on monitoring and how the outreach plan relates to the PATH monitoring guide. So when you check the boxes on the outreach plan, these items in monitoring are automatically covered if you have checked the boxes thoroughly. So PATH monitoring checks that your outreach covers the entire CAN region, prioritizes the most vulnerable. There is street outreach outside of the regular normal business hours when it's most likely to find people who are sleeping outside. We want your outreach plan to be specific to year-round canvassing. So how does it differ in the summer versus the winter? And then of course, with COVID, how does it differ when things are closed versus when things are open? How does your canvassing schedule change? Does your outreach plan engage those hard to find populations, people who may want to fly under the radar for fear of some kind of legal repercussions? So youth and undocumented immigrants, families who may be afraid to be found and engaged in any kind of official capacity. And then, of course, how does your plan address physical needs, and how has that changed due to COVID? More monitor items, as I said, in-reach schedule versus outreach schedule, phone versus email contact, which may be, again, more important than ever during this time when people aren't out and about in their usual locations. How are you taking advantage of phone, texting, emails to your clients, and then to people who might be aware of what's going on with your clients? Are you in contact with more medical clinics, medical professionals? Are there different people at DSS that you might have contact with who might be able to refer newly homeless people to you?
Let me just, Shannon, can I just say
Yeah,
something about,
absolutely.
when we talk about schedules, be careful. Sometimes when you're down on staff, you tend to just plug in existing staff to an outreach schedule. Don't do that, because one of the things that happens is you see quickly when you look at the schedule that people are double booked. And I realize that all the outreach workers are superheroes, but you can't be two places at once. So if you're having trouble with that sort of stuff, one of the things that we suggest is you talk to Brenda about how you handle it and let her know that you're down on staff and this is what you're going to do, and have some sort of plan with her. Don't just plug them into the outreach plan. I used to do that myself, and it creates all sorts of problems. So they want to make sure that people have coverage. If you need to, downsize who you serve or something and you can't get staff, we understand that under COVID at all times. So definitely talk to Brenda before you just plug in the existing staff. Brenda, did you want to say something about that? Is she still muted? I think you have to unmute.
Okay, unmuted.
Oh, there it is. Okay, yeah. Yeah, it keeps telling me the host has me muted, which I don't know, Shannon, if you're doing that on purpose.
I am not doing that on purpose.
You want to stick to the timeline, right? Be done by 12:30.
No, we'll be good.
No, I think that was good, Andrea. I just wanted to take a quick second because I know that there's a lot of different outreach programs on this training call, which I'm so happy that the word got out. I know we have some Latino outreach folks, and we have some of our women's programs, Reach Navigators, in addition to just all different types of outreach. So just to be specific, that a lot of this outreach planning is around the SAMHSA funded through DEMIS PATH outreach program. So that's a lot of what we're talking about, but it still pertains to anyone else out there who's doing outreach. And you can certainly request any of these tools if you want to use them ongoing. Thank you.
That's great. Thanks,
Thanks,
Brenda.
To just resume this slide here, how do you respond to public concerns? If somebody calls 211, how are we getting that information and how are we following up on those types of referrals? And the coverage plan for staff absence is more important than ever now. And it relates to what Andrea was saying earlier. How are we being thoughtful and planful about risk factors? Who is well enough to do some face-to-face contacts at this time and who is not? How are we swapping out that staff? Are we cross-training staff? Because of staff absences, there might be a need for some people who don't usually do outreach to step in and make some phone calls or do some coverage for the regular outreach staff. But we really need to plan for staff sick time due to child care challenges, family and staff illnesses, and just the need to cover all departments within an agency. So how are we being planful about that? And then, as Andrew was saying, are we changing the scope of what we can do, which we may need to do with some of the staff limitations? And then response to cold heat, what's our plan for those situations and emergency conditions, which this certainly qualifies as an emergency condition. And going back, just a reminder again to what Andrea said, how are we responding to emergency conditions and still focusing on getting people into housing, not just covering and not just finding new people, but still working with those people that we have to get them into permanent housing. So following up on the vulnerable people identified in the PIT count, using this template, the outreach plan template, and then updating it by supervisor monthly and having a sign off by the CAN and DMS twice a year. Those are the monitoring items that are in that if you fill out the outreach plan completely, they will be covered. So again, just a reminder, as comprehensively as you can, complete this outreach plan and really look at another plug to look at that sample outreach plan because it has some great examples of what can be done during COVID and changed, but of course, customize it to your own program and your own program needs. That's all I have. I'm going to hand it off to Andrea now for staff and client safety during COVID.
Shannon, Damaris requested to be unmuted, so I just wanted to let you know that while we're doing it. And let's go to the next slide. Sorry.
Damaris is unmuted.
Okay. And then the next slide.
Good morning.
We can hear you.
This is Damaris.
Hi.
Thank you.
You're welcome.
Hi, everybody.
Hi.
Hello.
Morning. So one of the things that we want to talk a little bit about is safety during outreach. So one of the most important things is to wash or sanitize hands before and after each encounter. Do you want to think about if you have the supplies, those go in the plan as well. And if your the people you serve who are still living outside have hand washing stations, that sort of thing, or have materials that they can disinfect their hands. The other thing is to do it in well ventilated areas. I'm sure that you guys aren't going into tents. That's not something we advise, but do it outside as much as possible, and even meetings in the hotels, if you can do them outside the hotels. Oftentimes they have areas where people can sit, and socially distance will be in the sunshine. You want to maintain at least 6 feet between you and your clients. They're actually recommending more than 6 feet. but you want to protect the confidentiality of the discussion, and you don't want to be shouting at each other, but you can figure this out, but you want to keep at least 6 feet between you. The other thing that people have mentioned is that on outreach, some people are a little freaked out by the staff wearing masks. Some staff have put pictures of themselves on it, but if you're going to take off your mask to show people that who you say you are, you want to do it at least 12 feet away from the person. And then as you get closer, you want to put the mask back on. You want to establish protocols about what you're going to do in the disaster, including how you get people into hotels, what to do when people are sick, how to get people emergency care, how to connect people with housing resources, that sort of thing. And you want those all in your disaster response protocols. And there's a part on emergencies in your outreach plan that asks for that, and that's a really good start. And you also want to ask people about symptoms. Symptoms are a wide breadth of things, but we have made the CDC updated guidelines available to people. They also include some gastrointestinal things, something called COVID toe, which is not unlike frostbite, but also things like any kind of trouble breathing. You want to get people help immediately. People are running a fever. I don't know if you guys have, thermometers that you can use from a distance. Those can be really helpful. Otherwise, just asking people to do that. The other thing that is part of the screening is you want to be prepared to tell people what will happen if they test positive, right? People are afraid they're going to be put in isolation, and the only kind of isolation they've had before is probably not been a pleasant experience. You want to explain what it looks like. You also want to explain to people that, what are symptoms, how they can get help, and protocols in the hospital. The other thing you want to explain to people is we want people to get as many tests as possible, but people are really afraid of what looks like to me a lobotomy by Q-tip. And but there are a lot less intrusive tests that are available. So you want to know what kind of tests they're providing for people, and you want to talk to them about it, right? Because people have been really concerned when they see the kinds of tests that happen. Okay, let's go to the next slide. This is one of the charts that actually came from the CDC. And if you have high risk, you should use PPEs. If you have lower risk, you can use fabric covers. I know that a lot of the people we serve at fabric covers, I would recommend that you use PPEs when you go see somebody. High risk populations are high density, congregate shelters, encampments, that sort of stuff. Face-to-face, in-person meetings to provide, housing information and safety information, and to provide people with basic needs. And that workers exposed to or providing care for known or suspected patients are high risk, and so you want to probably stay home in that situation. Remote workers, those working from home during the pandemic can certainly use those for their everyday life. Workers providing telehealth, you don't have to wear the mask on telehealth. This wasn't clear on that subject, but feel free. You don't have to wear a mask if you're the only person in the room. And workers don't have frequent contact or sporadic contact. One of the examples they use is sometimes going in a grocery store. Unless you're a high-risk person yourself, you could probably use a cloth covering. Okay. Let's go to the next one. You want to ensure that staff have seen the CDC infection control guidelines. You can click on them. You have this PowerPoint. You want to avoid transport without vehicle adaptations, which includes a screen between you and the person you're transporting. If you yourself are high risk, or if you've been exposed, you should obviously avoid face-to-face contacts and work that out with your supervisor. Shannon mentioned cross-training staff because we're going to need to shift people. The other thing is if you're going to cross-train staff, you should introduce them to the people you serve. So when they come in to help them when you're not available, it's not the first time they see them, even if it's over the phone or over some sort of video thing. And then we need to help people by providing regular supervision and ensuring that people have the things that they need and they can talk it out. Look, this is really frustrating work. And that one of the things that we want to do is get a little distance. It's hard to get distance, particularly in an outreach team. I worked outreach for a long time and I loved it, but you know, it was really helpful to get another perspective, to back off a little bit. And that's why regular supervision is so important. And we know in times of crisis, supervision usually goes by the wayside, but really prioritize this service that we can provide the staff. Okay, let's go to the next one. The other thing is staff needs to take breaks, practice self-care, take a walk once in a while, take a lunch. Even if you're doing remote, take a lunch. And helping your kids get their homework done during lunch, that's not a break. You may have to do that, but take a break for yourself. You want to, you know, ask for help when you need it. You know, take a walk, do some exercise, healthy eating. Yeah, well, that's gone by the wayside with COVID, but, you know, make sure that you're sleeping, try some meditation techniques. You want to avoid alcohol, drugs. You want to connect with others, right? And that connect with others who aren't in this field. So that, you know, it's important for us to have our own lives and we want to protect that. So, you know, as much of that as you can do as possible would be really helpful. The other thing that's really helpful here is really sticking to a schedule. So scheduling it, but schedule yourself some breaks. You also want to, if you want to change behavior, or if you want to back up, if you want to help people change behavior, we need to provide education. So having accurate information is really important. And we've got some links to different flyers that present the information in a more of a graphic than in verbal. And one of the things that we know, particularly people who have histories of mental illness, the onset is usually late adolescence, early adulthood. That's also when executive functions are established. So you might notice that people have some problems with, you know, task prioritization, task sequencing, organizational skills, that sort of thing. That's because those executive functions are still developing. One of the real hallmarks of having trouble with executive functions, and remember, they're developed in late adolescence, early adulthood, when a lot of the people we worked with are compromised, is that people have a hard time with verbal directions. So the less wording you use in these flyers and the more graphics, the better, and we've provided some of those things. The other thing is to work with, you know, partners to avoid encampment clearing. Some people, the safest place for them might be the encampment. We want to make sure that people are safe. We want to make sure that they have adequate hygiene and adequate PPEs. And we also want to make sure that they're not infecting each other. And we want to make sure that people who are sick can get the services that they need. And we want to separate the people who are symptomatic. I realize that a lot of the transmission happens through non-symptomatic transition. So you want to use those testing sites as much as possible, but we want to definitely separate people if we can. We want to also try to help people separate the tents or the encampments or where they're sleeping. That's really important. They should not be right on top of each other. Sometimes people have done that for safety in the past, but we want to really encourage it. So, and then we want to encourage people to be able to use telehealth and stuff. I just saw that. We want to encourage frequent hand washing. There's a do yourself, do your own, or hand washing station link here. It's basically, you know, a gallon of water with a spigot in it. It's a pretty simple thing to put together. And then you provide people with soap. You obviously can provide people with hand sanitizers if you need to do that. And then giving people access to toilet and shower facilities. I'm expecting some kickback because they did say that the COVID is in existence in human waste. We want to make sure that people have a place to go to the bathroom, and that in a bathroom, right? And that we really use those hand washing stations and those shower and toilet facilities. And then we want to make sure that they have any needed medications, which is really important, a way to keep them safe and a way to take them. The other thing is to talk to people about access to Narcan. Connecticut has been way ahead of the curve in terms of giving people access to Narcan, but helping people set up a harm reduction plan so somebody can help them if they need it. They should under no circumstances be solely reliant on the case management because you're not there 24/7. They should have some sort of plan about how to access that if they need it. We want to also, distribute hygiene kits, weatherproof supplies, big baggies, big Ziplocs are our friends, as much of those as possible. Giving people water and food that they can use, but also giving people access to things like Pedialyte and powdered Gatorade that they can mix with water. I don't know about you all, but the people I served in New York, they wouldn't drink water to a larger extent. But if it was Dayglow colored, they were all in. So we try to give people as much as possible, and Gatorade can also replace needed electrolytes. The other thing we want to think about is some people may be diabetic, and Gatorade has an enormous amount of sugar in it. So there's some specific drinks for people with diabetes. We tried to give as much of those as possible to everybody because that much sugar is not great. We want to give people tissues, and we want to give people hand sanitizers, masks, gloves. Trash bags is really important so they can secure things. They're going to need soap, shampoo, feminine hygiene products, particularly to go into those shower facilities. And the other thing is you want a list of health and mental health and substance abuse resources that people can use. You can also often program them on people's phones so they're automatically there and that they have the numbers and they know where they are. A lot of people have done by telehealth, so just giving people a lesson about how to use their smartphones. A lot of people have smartphones. If they don't have smartphones, then we've got to figure out another way to do it. But telehealth can be really a huge thing, and they will do it by phone call oftentimes. Then we want to give them basic information on COVID and symptoms and when to seek medical help and how to get the medical help. So it might be as simple as, look, I'm at this soup kitchen every Tuesday from 10 to 11, and I'm at the library on Wednesday, and I'm at these places. I'm going to give you a list of where I am. And if you need help getting somebody help, right? It's often somebody else in the encampment who comes for help. See, you can always grab me there. The other thing is what people can do independently to get the help. Can they call an ambulance? How do they do that? How do they get people to go? But if they want your help specifically, letting them know what your schedule is incredibly important. The other thing is how to obtain food safely. A lot of people are doing these packets. A lot of soup kitchens are giving out prepackaged meals and not having people come in. We want to let people know about that. We also want to talk to the soup kitchens if people can get more than one meal so that they can share it with others in the encampment. So it may be possible that everybody doesn't have to go out every day. We want to get client contact information and document that in a shared system. And just keep in mind that contact information always, what you want to do is who can usually get in touch with me, right? Is there somebody that I keep in touch with regularly if you can't find them? And the other one is where they go when they're not in the encampment or they're not in the hotel. Do they go to their mother's place? Do they go to the library? Do they hang out at the soup kitchen? Do they hang out in another encampment? You want to know that stuff. If I need to find you and you're not here, where can I find you? And people are usually willing to give that information. And that's a really important tool in outreach. Okay, let's go to the next one. So we also want to coordinate discharges from correction and health settings and find out if people are positive or not, though there can be some tricky things with HIPAA, but you can usually get that information. You can facilitate cell phones and minutes, and we have a phone carrier with the free telephones and how they can get extra minutes. The other thing some people are doing, and this is making me a little nervous, but what they're pinning to their tents is they're giving people a laminated red, yellow, and green sign. So they can put a green sign at their tent if they're okay, a yellow sign if they want you to check in with them, and a red sign that says you need assistance. But I think that people are usually, I don't know about your people, but the people I worked with usually waited till the last minute. So we want people to have people come and get us if they really need help, or call emergency services. So we want to tell them that, but this might be a good system for people. I don't know. Okay, let's go to the next one. You also want to really work with people towards permanent housing. The goal gives people structure and purpose, which helps them take care of themselves. And that it's really important that people understand that there's a light at the end of the tunnel. We've already had people we serve asking questions like, when's this going to end? One of the tenants in one of the buildings that I've been working with lately said to me, this is never going to end, isn't it? And, you know, it really does feel like that. But giving people an idea that they're working towards something positive, and as you said, people are having a chance to experience having their own bathroom and a place to lay their heads and all of that is really important. We want to use that. We can also start working on those behaviors that people are exhibiting if they do come inside, either in shelters or in hotels. So, and really connecting it to housing. We need to talk to people about housing and talk to people about what kind of housing they like and what their experience has been in these emergency accommodations. We also want to provide people with access to testing, but we want to do a lot of education first, including what the test will entail so people can be prepared, because the rumors out there are a lot worse than any kind of test. We want to provide people with medical care or even telehealth medical care, and talk to people about they may need a place to rest for a while, and it may be a reason to use the hotel. And we want to provide people with a means to quarantine and isolate. And it might be an individual tent if that's necessary. There's some things that the Harm Reduction Coalition had some really good information about people who use drugs and how to do some harm reduction with that, because we're worried about people going out to get the drugs. We're also worried about risk of overdose and different things with drugs. We want to talk to them about that. Harm Reduction Coalition has some resources for that. And Vital Strategies also has some information about harm reduction. Okay, let's go there. I see some comments, so I'm going to pause for a minute. McCall Center for Behavioral Health successfully transitioned to telehealth services. That's great. That's available to everybody. Keep these coming, these resources. Let's see what else we got here. Great. Okay. I think I hit the questions.
Yeah, I think we're good.
Anybody have other questions? No? Okay.
Yeah, but continue to put your questions in the chat box if you do have them. You want to say something else, Andrea?
Look, y'all, we don't want to reinvent the wheel. So if you have a resource you think might be valuable to other people in the group, please don't hesitate. It is incredibly helpful. I would suggest that all outreach programs get together a working list of resources. It could be on a computer, it could be on a pad or something that you pass around to people so that people don't have to reinvent the wheel. If they need a behavioral health resource, this might be a resource they could use with telehealth. There might be other resources. There might be substance use resources and how to get into a substance treatment center. That might be really important to people. So if you have those kinds of resources, please post them.
Absolutely. And I'll give a plug for the CT Boss website. There is a special COVID page on there, and there are some resources there as well. But the resources that you all have found in your own communities likely are not on that page. So, well, some are and some are not. But so what Andrea is saying, please share what you found here too as well.
Absolutely. And Shannon, we can share these on the CT Boss website too, right? So it's in a central place.
Yes, for sure.
That's what
Yeah.
you want to look at.
Mm-hmm. Right. All right. I'll move on to the next steps. We'll just go through some dates for updating your outreach plan and some specific steps about how you might update your outreach plan. So hopefully you've all been updating it prior to now with the advent of COVID and how so much has changed. And maybe you've just done this on a more day-to-day basis, adjusted what you're doing, but not updated the plan. But now we're getting towards the time where it needs to be reviewed again. So discuss the plans at your CAN. Update the plan template, and the next slide will go through some of those specifics again about how it might be updated in light of COVID. Have a CAN representative sign off on the updated plan and submit that updated plan to DEMIS for approval by 8/31, by the end of August. Past supervisors review the plan monthly and update it as needed, and then continue to submit to the CAN and to DEMIS for approval every 6 months.
Okay.
So when updating the outreach plan, these are a few, again, call outs, and it's a bit of reiteration, but sometimes that helps people remember or sparks some creative thinking. So again, I want to give a plug. The sample outreach plan that was put together really has some excellent strategies that you might consider putting in place if you have the capacity to do so. So look at that, give that a good look. And
Shannon, we have time, so I think that pulling that up later might be helpful to people, just to give them some ideas.
Okay.
Is that all right?
Yeah. Again, canvassing and inReach. How are you spending your time outside? How is that possibly more targeted given the COVID restrictions? How has it changed? More contacts by phone, outreaching to the hotels and motels, and how are you thinking about a safe plan for when things open up? Do you have, excuse me, a step-by-step strategy on how things are going to go back to quote unquote normal? How are you planfully thinking about those things? So, list of program participants with the greatest vulnerability. Have you looked at people now? People who are experiencing homeless by and large are more vulnerable in general, but have you looked at perhaps people who are older? And people who have pre-existing conditions, and are they receiving more outreach or targeted outreach at this time? So how has your list of program participants changed? Again, people that you're able to provide full case management to, is that changed now with COVID? Do you have the same amount of resources that you did before? Are you thinking some of the people who have greater vulnerabilities are needing more resources? So how are you changing that if you are? And if you are you in communication with Brenda and DEMIS regarding that? As Andrea said, don't just try to check all the boxes and say, your outreach worker will be at all places at all times, because we all know that's not possible. phone, email, outreach schedule. What providers and locations make sense given COVID? Are there places that you're adding to your list? Are there people that you're taking off the list because they're closed or people just aren't hanging out in the same places anymore? And another plug for coverage. Are you cross-training people? How are you planning for staff absences? And in the sample plan, there are some good ideas about this if you're able to do them. Emergency plan. Are you adding protocols for infectious disease outbreak? That's a trick question. Add protocols to your plans for infectious disease outbreak, for sure. Let me see, supply, emergency plan, and then supplies, add masks, gloves, alcohol wipes or disinfectant wipes, all of those things, are they added to your supplies? And if not, do you have a plan for adding them? And just making sure scheduling other staff tasks is not on this list, but please, as Andrew was saying, keep supervision and team meetings on your schedules, especially at stressful or trying times such as these. That's more important than ever. And just a snapshot of the outreach plan timeline. Again, the plans are approved by DEMAS and the CANs twice a year. The original plans were submitted back in March. This month and in August, you're making updates to the plans and getting CAN approval for those plans. And then by the end of August, those updated plans are due to DEMAS. And then we have these tools that are all, these are all links. So again, places to find the outreach plan template, the blank template. The sample outreach plan is, these are on the CTBOSS website. The assessment and service plan, which we'll be talking about in an upcoming webinar. Housing target tracking tool, one place, one shot way to keep track of where you're finding people, and then consumer survey.
Shannon, is this a good time to pull up the sample outreach plan? And
This is a good time. Yeah, so if I can pull that off, let's see. Let me share. All right, is it up there?
Yep.
Okay, so,
Full screen, that would help.
how about if I just make it bigger? Hold, let's.
That's better.
That's good?
Yeah.
A little there, okay.
Can you see it? Can you guys see it? Let's scroll down a little bit and just hit some of the highlights. So this is obviously where you are. This is your schedule. And as I said, it's really important to, you know, make a schedule for the staff that you have. Have people covering, plug them in, but also talk to Brenda if you're having trouble doing some of the coverage, right? Because of situations that have arisen out of lack of staffing or somebody's out sick or something. You want to put them there, but you also want to keep in mind the schedule so that the people you serve, particularly people who are in, who are still outside, can find you if they need you. So they can come by where you are, and that gives people a lot of power. It gives them a little control, but it also is very reassuring that if you don't come by for one day, they can go see you. Okay, so go down a little bit. This is the InReach schedule, and there's an agency assigned, but there's also who you're in contact with there and who can contact you. So that's very important in the InReach schedule. You also want to consider those emergency housing placements as part of the InReach schedule, because I'm assuming that you're continuing to see people there, so you may want to add them in the time of COVID. Okay. For the case management plan, right? You provide case management. Who you provide case management to, as Shannon said, your vulnerable people, which is going to be listed, is going to be maybe changed. So you want to make sure about that, particularly people who are having trouble dealing with this. And then you want to do it by client, how often you're going to see them. So the other question I have for you all is, if your people have been moved to shelters, emergency placements, or hotels, do you continue to see them for case management? Or are there some cases where the person is in a hotel or a shelter where they provide case management and they're willing to take it up? So then you want to think about, when you put your emergency plan in place, how you're going to do a warm handoff to the case managers in the shelters. If they don't have capacity or they don't have case managers, how are you going to continue this contact? So that's going to be really important. And how are you going to continue to work on their housing plan with them, and who's going to be responsible? So it's going to vary throughout your community. Some people in shelters will likely have some sort of case management. In hotels, it's sort of hit or miss. So you may be expected to continue your case management. So you want to make sure that that's in your schedule and that's in your plan. Okay. As we get to, right, so there's the outreach schedule. Let's go to the emergency plan, because that's the big one. Coverage plan is also in there, so you want to make sure that you're doing that. Uncovered areas are going to be huge, right?
Emergency plan. Here we go.
When you get to the emergency plan, you want to make sure that you put in things like, you know, certainly weather events, but that people are familiar with COVID protocols, that your staff has PPEs that they need, that you're distributing them to the people you serve, both in hotels and outreach into the streets, shelters. Once again, if those things are provided in the emergency placements, you want to be very specific about that. You want to talk about, you know, food is a big issue, hand washing stations. If people are going to be placed in hotels or shelters, those are available to them. So you want to say very specifically about that. The other thing is, go down a little bit. That's the, wait a minute, up a little bit, sorry. See the last paragraph? Yeah. So the also want to say, if you're going to follow up with identified vulnerable individuals and people who receive case management in the emergency placement, who's going to follow up, how the housing plans are going to proceed, right? And that how you will do it. So in this case, we gave an example where the outreach worker remains the primary for people who don't get case management services in their emergency placement, and for the people outside, but that works with the case management that's provided in the shelters and in the hotels, if it is, to provide that, and they will check in with the worker regularly. So it's important that the momentum that has started in terms of the housing plans and getting people to a permanent safe location is continuing, and you want to talk about how that's going to happen. Okay, go down a little bit. So go ahead. Somebody wanted to say. Brenda?
No, I was just trying to stay unmuted because throughout there was just some things I wanted to say.
Oh, you're welcome.
For some reason it keeps muting me. I'm not sure what's going on.
Well, it might be the Russians.
No, I was just going to say early on when you pulled up the outreach plan, just in that first section where it was kind of breaking out the canvassing schedule and the in-reach schedule, just to be, just to remind everybody that the expectation is that you're meeting with your coordinated access network. So that's all the outreach programs that are in your area. So it could be any of the outreach programs on this call, or maybe other programs that are not on this call. Like I said earlier, the expectation is the PATH outreach worker is doing this to satisfy their SAMHSA requirements. That's why we have to do it. That's why we have to monitor it. But the expectation is that that's filled out with numerous programs, numerous agencies, and numerous people in the community doing different canvassing. So I just wanted to kind of make that clear. If there is nobody else and PATH is the only game in town, then obviously you can only do what you can do. But we're hoping that there's a collaborative effort within the coordinated access network.
Yep. And also to be specific of how you're coordinating and how often you're meeting with them, right?
Yep.
Great.
Yeah, and then also, I don't know if you've gotten down to the most vulnerable people, but around case management, again, specific with PATH, I know there's been some back and forth because DMIS hosts our quarterly statewide meetings, and there is quite a bit of, assessment and progress notes and case management that goes in to working with PATH clients. But again, we really just want to focus on the most vulnerable clients because we understand we don't get a ton of PATH funding statewide, and some areas don't even have a full-time person doing PATH. So just to kind of keep it real, right? How many people can you really see? Maybe you have a quick contact, but then the people that you're enrolling in the program would be your most vulnerable people on this list. So it might just be 3 people, it might be 5, it might be 20. Just to remember that these are the people who are going to need that ongoing case management, therefore documenting that with your assessment and your case notes.
Yep.
All right, I'll be quiet for now.
No, you're good. Other things. Brenda, one of the things is that if somebody is in a hotel that provides a robust level of case management, people can switch people off the list, right?
Yes, definitely can. Although we do ask that as a PATH outreach worker, if you have somebody that's outside that wants to be moved into the hotel, that you follow them in and you work with them until, like Andrea said, there's a warm handoff to a shelter case manager in the hotel. But if they're still your client under PATH, please keep working with them in the hotel. We're asking you not to put them in the hotel and then kind of leave them. So yeah, the warm handoff would be perfect, or just continue working with them in the hotel.
Yep. Okay. Public awareness. Where people can about people and they can get some assistance, right?
Actually, I'm sorry, I'm going to jump in again, Andrea. On the gaps, a little further up on the plan for the section where we're asking you to fill in the gaps, please just also keep in mind that that's not just geography, right? We all know that there's areas of our CAN that maybe there is no outreach program, but it's also gaps in the system. So just to be really clear, if there are soup kitchens that just aren't participating, or if it's law enforcement, or if it's a library or anything else that's in the system that you feel you need more strength in your area, put that in the plan as well. There's a lot of statewide meetings that I could bring those issues to so we could try to resolve them. So it's gaps across the board, geography, capacity, and your system.
Brenda, people have mentioned before on these calls that if somebody does want drug or alcohol treatment, it's been hard for people to get people in. So that might be an example of the gap, right?
Yep, that could be a gap, or it could just be, training and education. I know we have the live site with real-time bed availability in Connecticut. I know we're implementing some different 24/7 call lines for mobile crisis. So it could be either, but please, put that in your plan and let's talk about it.
Great. You want to go down a little further? Engagement supplies, as mentioned, should include things that you need during this pandemic, sorry. And keep going. Okay, and then the plan,
That's it, yeah.
and it's gotta be signed. Does this make sense? This was a quick overview, but we wanted to give you guys a chance to see some of the things that might be. You guys all have the plans that you've done the last time. You want to update those. Do people have questions about this or anything we discussed today? Why don't we, Shannon, why don't we unmute
All right.
everybody centrally? And then if people have out,
Hold on. All right. Everyone's unmuted. So mute yourselves if you don't want to speak, but if you do have a question, now's the time.
So I probably have to give her like a code or something like that, like when you
are you,
Yeah, if you don't want us to hear what you're saying, please mute yourselves.
yeah, there you go.
There you go.
I'm taking some liberties if I hear unrelated sounds to mute people.
Hi, can you hear me?
Yes.
Yes.
Some of the engagement supplies we get, but what's the highest demand in Central is tents. And when I need a tent, I have to go to another organization and ask them if they have tents. Can you suggest on how we can get tents in Central?
How you get tents?
Yes.
Question. Yanira, you might you want to talk.
I can't hear you.
You may want to mute yourself. You must got an echo going. There we go. Perfect. So the question was how to get tents. I know that there's a number of organizations that were giving them out nationally. How do you get tents in Connecticut? Does anybody have a resource for that? No? Okay. So tell me, I'm sorry, all I've got is your phone number. Tell me your name.
Vera Clark from the Friendship Service Center.
Okay. So what we'll do is we'll get those national resources together and we will send them out to everybody and we will make sure that you have them.
And another thing I have is there anything for pet care for individuals who are in encampments that have pets during this time?
That's a good idea. So are you talking about if they're staying in the encampment, things like food and that stuff and that sort of thing? Or are you talking about if they go to a hotel? Some hotels.
I'm talking about natural resources. I'm not talking about the sheltered part because most of them won't want to go to shelter because of the pet.
Okay. So I know that the law says you have to accommodate pets. So that's part of it, right?
Okay.
They have to accommodate pets if they're service animals or companion animals. I'm sorry, they don't have to. I think that there's a hotel, there are a couple of hotels in Connecticut that may accommodate pets. But if pets are a barrier to people moving in, we can definitely do some research around that. But if you need pet supplies and that sort of stuff, I thought there was something in BOSS about that. Shannon, was there?
I'll look.
We'll look and we'll make
Yeah.
sure that everybody gets it. Is that an
Thank
issue coming up? Do you have people that are not moving into emergency placement because they have a pet?
No, it was a issue previous to COVID.
Yes, it is an issue with COVID. Yep.
I think you have to make accommodations if it's an emotional support animal, right?
Support animal, yeah.
Yeah.
All right, try the copier. I might have gotten it to go. I fixed it for mine.
What? Carolyn, we're hearing about your copier.
I'm sorry, I didn't realize I was not muted.
Okay. Portia, did you want to say something?
I do. Can I say something? Can I ask something?
Absolutely.
I wanted to know, I just came on board for the Institute of Families
Yeah.
here. And I wanted to know about the plan. I'm not familiar with the plan. Is there any way that I can expose that I can take a look at it and go through
The
it?
outreach plan? Yes.
Yes.
So Shannon, you want to talk about that, where it is?
Yeah, sure. There are links in this in this PowerPoint presentation, which is available. It's attached to the invite if you responded to the invite, and it's also in the chat box. You can I attached it in the chat box. You can download the webinar presentation from there, and there's a link. And the sample policy is also on the CT Boss website, which is ctboss.org, and it's on the resources page of that.
Damaris,
Okay.
those are all available to you. You also want to ask your agency about your last plan.
Okay.
I'm not sure if you're a path provider or not, are you?
Yeah, I'm gonna go ahead and ask because I was looking at everything and I was like not clueless but wondering where that plan is. But I'm gonna ask and see and go through it, and if we have one, then I'll just go through with that one and see what I can add and what I can
Right.
take out, because as you say, with the COVID and everything that's going on, maybe a lot of stuff have changed from
Yep.
them.
Right.
Yep. Great.
Damaris, what is your outreach program?
My outreach program is based on well, it's included with the rent deposit, also included with the basic needs. It's and linking
Okay,
them to.
so you're not a SAMHSA funded PATH program, are you?
Huh? I'm sorry?
You're not one of the SAMHSA funded PATH programs?
No.
Okay. Okay, so that's probably why you haven't heard about this plan, so that's fine.
Yes.
But I think it's great that you're interested in checking it out and maybe using it moving forward.
Yes, I like it because it's step by step. So that's why I'm asking. I really
Yeah.
like that.
Good.
But thank you again for everything.
Sure. People have other questions? Are these things coming up for people? No? Okay. So Shannon, we're going to close it out, give people back at least 15 minutes of their time.
Yeah, Brenda, any last words to add? I want to thank you all.
Again,
Oh, go
well,
ahead.
I'll just quickly again, I'll just say thank you to everybody for joining the call. I don't know if Shannon, if you want to pop, I know we're about to log off, but the BOSS site into that chat box. I know that came up a couple times for anybody who might want to look at all the other resources that are available. And that's about it. If I didn't see your name in the box, I am kind of checking to see which PATH programs are on. I think I've got everybody that's on the call. If for some reason you logged in with a phone number and you want to send me an email to let me know you're on the call, then you can certainly do that. Again, that's just for the PATH providers because this will be tracked as part of our annual monitoring. But again, thank you so much, and I hope we see and hear all of you next week as well.
Yeah, thank you all. And next week, for the next 3 weeks, just to let you all know, I knew most of you are on the email list, but for the next 3 weeks, there will be additional outreach webinars that Andrea, Lauren, and myself and Brenda will be staffing.
Thank you. I'm looking forward to those.
Thanks, Damaris.
And you have a list, right, Shannon? Is there a list there?
A list of the upcoming.
Yeah.
I don't, let me see. I will tell, I have on the 23rd at 11, helping I don't have a list, but I'll tell you. The 23rd at 11, helping participants understand housing options.
Options.
Then on the 30th at 11, Establishing person-centered housing-focused goals is the webinar topic for that day. Let me look at then August 6th is the final one, and the topic is how to set expectations in housing. That's the last of the 4.
Here we go.
Yep.
Brenda, I don't know if you saw the chat box, but CCFC joined.
Yep. Okay. Thank you.
Great. Okay,
All right. Thank you all.
thanks so much.
Take care.
Have a good
Thank you
week.
very much.
So
Mhm.
Have a
listen,
good weekend.
15 minutes to take a break.
Right.
Exactly.
Everybody who needs one. Take care.
Bye, everybody. Take
Take
care.
care.
Bye.